Hello everyone. Let's review some helpful hints when coding for endocrine, nutritional, and metabolic diseases. A big focus of this chapter is centered around diabetes. So let's do a quick review and compare type 1 and type 2 diabetes, as the difference between the two does play into how we code for this condition. So type 1 is defined as when a patient's body fails to produce insulin. It's not producing insulin. So it can be safely assumed that the type 1 diabetic will require regular insulin injections just by the sheer fact that the body is not producing it. Again, we can assume that the regular insulin injections are happening. On the other hand, type 2 diabetics are described as when the patient's body produces insulin, but it is not produced at a high enough quantity as compared to normal levels. Or it could be that the body is just unable to use the insulin properly. So insulin is being produced, so the patients usually do not require those regular insulin injections. At some point, they may be prescribed the insulin injections, but it cannot be assumed. Usually this type can be controlled by diet and exercise. He's got his little running shoes on here. These two definitions for type 1 and type 2 leads us to a discussion about the code Z79.4 for the long-term use of insulin. This code can be found, as we learned last week, by finding the main term of long-term drug therapy and then the subterm of insulin. This code is not required when coding for a patient with type 1 diabetes. So it's not required. We know just by definition, since the patient is not producing any insulin, we just know by definition that the patient will already be using the insulin injections on a regular basis. That long-term drug therapy use is implied, so we don't need to code for it. I would never mark you off if you did code for it, but just know for type 1 diabetics, you do not have to do that. However, since most type 2 diabetics do not receive regular insulin injections, it is important to include this Z79.4 code if there is that prescription for the long-term use of insulin. So again, we cannot make that assumption in type 2. So it should be coded if it is the case. So again, include this long-term use code if the type 2 diabetic has been prescribed the insulin and is using it regularly. The same can also be said when we are talking about secondary diabetes. So what is secondary diabetes? This is when the condition is brought on either by another condition or event. For example, it could be brought on by another underlying condition. It could be induced by a drug or chemical that the patient is taking, or it could be brought on as the result of medical therapy. An example of this would be, let's say the patient had the pancreas removed. Well, the pancreas produces insulin, so that would be considered secondary diabetes, not type 1, not type 2, but something that is the result of that therapy. When coding for diabetes, it is imperative to note that many complications often arise from this diagnosis. For this reason, it's important to assign as many codes as necessary to identify all of the conditions or all of the complications that a patient may be experiencing. So code as many as needed based upon the documentation. For example, let's look at the diagnosis of type 2 diabetes with diabetic nephropathy, diabetic retinopathy, and diabetic dermatitis. So we would need to include the codes for all of these diabetic complications. We would, of course, start in the index with the main term diabetes. Very important here, make sure you're checking this first indentation level for the correct type, type 2. And then with, we have all of these subterms for with type 2 diabetes. So in this case, we would pull in the type 2 diabetic nephropathy, E11.21. We would pull in the E11319 for the diabetic retinopathy. And then we would also pull in E11.620 for the diabetic dermatitis. All three of these codes would be included for this particular documentation. And then, of course, you know to go check the tabular list for those instructional notes. Okay, we've had enough discussion about diabetes. I did want to walk through an example in this video before I let you go today. This is from the handbook, and it addresses a nutritional disorder, in this case, morbid obesity. So, looking at the diagnosis and procedural statements here, morbidly obese adult patient with BMI of 39. So here we have our diagnosis statement. Laparoscopic gastroplasty with gastric banding, our procedural statement. So let's figure out this diagnosis statement first. We will begin in the index with the main term of obesity. Scrolling through the subterms, we find morbid, which is applicable. So this will lead us to code E66.01, and as usual, we will check this out in the tabular list. So here we are in the tabular list. And E66.01, we have our fifth character assigned with that 1. So it looks like we are in good shape. However, we need to remember to scan through our category for instructional notes. So as we're looking through here, we can see for the E66 category, so any code that begins with E66, there's this note to use additional code to identify body mass index, BMI, if known, and then it directs us to the category Z68. So that's where we are going to head. So it's giving us direction. So instead of going back to the alphabetic index to start, we can go directly to the Z68 category, again here in the tabular list. And looking at all the options, the best choice seems to be Z68.39, body mass index 39.0 to 39.9, and we know up here in our diagnosis statement that we have the BMI identified as 39. So 2 codes so far from this diagnosis statement, the E66.01 for the morbid obesity and the Z68.39 for the body mass index. Please know for future reference, if you do ever need to look up body mass index, so for example here it told us where to go in the tabular list, but if you are ever starting from scratch and need to find a BMI code, you can actually start in the alphabetic index with the main term of body, and then there is a subterm for mass index. So just another option as you're trying to find these BMI codes. Now that we have our diagnosis codes, let's take a look at this procedural statement, laparoscopic gastroplasty with gastric banding. We have not yet gotten to our digestive system chapter where gastric banding is discussed. But just know that this procedure involves placing a silicone band, here's a good picture of it, around the top of the stomach to, in essence, decrease the stomach size, and that in turn reduces food intake. So this description of a procedure actually correlates to our root operation definition of restriction, which that definition states partially closing an orifice or the lumen of a tubular body part. So in essence, the stomach is just sort of an oddly shaped tubular body part, right? And the lumen is the inside of that tube. So we are partially closing part of that tubular body part, the lumen. So we will begin with our main term root operation of restriction with the body part subterm, of course, stomach, which leads us to table 0, D, V. We'll double check here. We have a restriction root operation. We will pull in, of course, the body part matches up, stomach. So our 0dV, our fourth character is 6. The approach value here is going to be 4 for percutaneous endoscopic. Why percutaneous endoscopic? Let's use our medical terms. In the procedural statement, laparoscopic, pertaining to abdomen scope. They're endoscopic, pertaining to within scope, a scope within, okay? So we know this is, they're using a scope for visualization for this particular procedure. So we have 4 for percutaneous endoscopic. We will pull in the character device C for extraluminal device. So how do we know this is an extraluminal device and not an intraluminal device? Well, first of all, let's remember, if we're going to use a device character, that means the device has to be left in the body after the procedure. So we know they're doing that. They're leaving that silicone band on the stomach after the procedure to do its job. So we definitely do need a device character, not no device. We definitely have a device being left in the body. Now, again, we're putting that medical terminology to use. Extraluminal, AL, pertaining to extra, outside of the lumen. So this band is going on the outside of the lumen, the outside of that tube, okay? Intraluminal would be, of course, within, but we see it's on the outside of this particular body part. So extraluminal device, and then we have our 7th character Z for no qualifier. So the final code here, 0DV64CZ. That's a fun one. As usual, happy coding this week. Remember to post to the Coding Roundtable and check answers there often. Have a great week.